Here at the British Society of Hematology meeting, we had a session on individualizing patient care in chronic myeloid leukemia and myeloproliferative neoplasms. We designed the programme with the overlap between these conditions in mind. First, kicking off with a fantastic talk from Adam Mead from Oxford, where he spoke about treatment-free remission in CML and chasing the disease stem cells. So it was a very nice talk, blending both the kind of clinical data, showing what you might need and how the criteria have changed to consider taking a patient off treatment. So the different molecular definitions that we use now, and then moving forward to how long you probably need to treat a patient for, and how long they need to be in a major molecular response for, and what that's changed. So that's all changed very much over time. And then looking at what the likely outcome is, and moving forward from that, he did a very nice thing, kind of segueing into very kind of high-tech science, but put across in a beautiful way that the audience could understand, talking about the differences between the CML stem cells, their quiescence, versus the non-CML stem cells. Ones where you can detect a CML stem cell and the patient's likely to get a relapse, or you can detect a CML stem cell and the patient's likely to remain in a treatment-free remission. And so that's really important now. And then he's shared with us some single-cell data, basically capturing genetic signature differences, which would then allow us, hopefully in the future, to develop new targets. Then moving on, our second speaker was a very dynamic younger hematologist, Godfrey, from Cambridge, who presented lessons from our PT1 study, which is a very old study now. In fact, she was in high school when we set the study up, and basically dissecting out what we know about biology, risk management, and then clinical management of essential thrombocythemia, a very, very diverse condition where treatments and treatment targets are very much changing for individual patients. And as we learn more about genomics, for example, we understand a bit more about how patients are responding to treatment. And then we were really thrilled to have John Mascarenhas from Mount Sinai and Tisch Cancer Centre, who gave us a fantastic overview of what's coming in the future for myelofibrosis, focusing on the JAK inhibitor pipeline, drawing attention to we still only have ruxolitinib, but we may well have pacritinib and fedratinib coming next. But then looking at other really interesting targets and giving a fantastic overview from Ash, and then his own overview, touching on, for example, the SMAC inhibitors, so targeting apoptosis, thinking about telomerase, the stem cell microenvironment, and then touching on his work with MDM2 inhibitors, so idazonutolib, and combining that, for example, with Pegasus. So all in all, I think it was a great session. It was packed. There were fantastic questions from the audience, and I think it showed that the interest is very high and things are moving on not only in science but also in the clinical field, as often triggered by discoveries in science.